Hello and welcome to today's video on the topic of what are the main lab markers for kidney function. The kidneys, they play a vital role in our overall health, and it's important to monitor their function regularly. In this video, we will be discussing the main laboratory markers that are used to assess kidney function. Why did I create this video? Mainly because many of my kidney patients are asking me what markers should I look at? What are the major elements that I should discuss with my primary care physician or with a nephrologist, whoever is taking care of the patient. And then what I did is I said, okay, I'm going to create a video and explain what are the major markers and what they mean, okay? Well, there is one to begin with, that is the blood urea nitrogen. It's also written, you can find it in the lab as BUN. This is the first lab marker that we are going to discuss, and is a waste byproduct that is normally removed from the blood by the kidneys. And if the kidneys aren't functioning properly, the level of BUN in the blood is going to increase. So you do not want to have those values high, because that indicates there is too much of waste byproduct in the body, okay? Second is creatinine. This is a very important one. I will consider the most important one together with GFR, okay? So the creatinine is the waste byproduct produced by muscle metabolism and is normally filtered out of the blood by the kidneys. And if the kidneys aren't functioning properly, the level of creatinine in the blood is going to increase as well, similar to the BUN, okay? So it's very important that we keep that creatinine level low. An important factor that it makes that creatinine to go high is the proper lack of hydration. So if you are dehydrated, creatinine levels are going to increase, okay? Third marker is the GFR, glomerular filtration rate. It's the most important. It's calculated counting the creatinine levels, your sex, female or male, and your race and your age, okay? And it's a measure of how well the kidneys are filtering waste from the blood. A low GFR indicates that the kidneys aren't functioning properly. We will talk later on in another videos about how the different stages of kidney disease, it's measured according to the levels of GFR. For instance, from 0 to 15 is a stage 5 kidney disease. 15 to 30 is a stage 4, and so on, okay? So this value, this GFR, it really is what makes the doctors to know in what stage you are, okay? Very important to look at. Electrolytes. In addition to the BUN, to the creatinine, and to the GFR, it's also very important to monitor the levels of electrolytes in the blood. Electrolytes like sodium, potassium, phosphorus, they play a crucial role in many of the body's functions. And the kidneys, they play a really important role in regulating these levels. And again, I repeat, like I mentioned in the other videos, an imbalance in this ratio of these electrolytes, especially sodium, potassium, is going to start really mining and reducing the state of function of the kidneys, okay? So there are another markers that you can look at in the blood, like protein levels are very important. Protein in the urine, that's what it makes when you go to urinate, that foam that is created, like thick foam that is created in the toilet when you urinate, that usually indicates that there is an excess of protein that is being excreted out from the urine instead of to be used to build muscles, to build bones, etc. So that's the other important factor to look at as the major markers that they define kidney function. Of course, there are other markers as well, but these are the major elements that you as a patient and you as a person trying to know how your kidney function is, you should be looking at these values. Okay? So again, click the like button if you like this video and like the information, and don't hesitate in contacting us to the website www.healyourlifeandbody.com. And please have a beautiful rest of the day.